Hello guys, very good morning. So I'm sorry that for the past 3 days I did not post any subjects. So actually I'm a little bit busy with the hospital. So don't think like sir has been out of the track. No. So I think we finished physiology almost something like we have only CNS, but don't think otherwise like sir has left topics. No, I think most probably I am saying most probably I did not miss any topics, but as per our schedule which I have designed for the INICET examination this March 16th, again I will have a revision of physiology, but this time don't fear, that will be a deep revision. A deep means deep, that means you will get into the most finest question that you may watch in the INICET. Beyond that depth you will not get. That's my assurance, trust me, that's my assurance. So this 16th you will have the physiology revision once again, so don't get disappointed. And for the rest of the schedule, tomorrow it's surprise, we are starting surgery. Because this time from surgery in the INICET, as per the previous 8 years of analysis, I'm expecting something like 22 plus 4 questions. 22 is straightforward from surgery and 4 with integration. And for bonus information, this integration also I am expecting surgery plus medicine plus radiology. Yes, this is a 3 subject integration, so you will be surprised in the examination. So be careful this time. The most tough subjects in the INICET that I am expecting are surgery for sure. Yes, trust me. This is not this time it will not be SPM will be something like 88% you will be getting a lenient questions, right? But surgery you will be getting nearly 64% of extreme hard level questions, right? And in that surgery 30% will be something like highly integrated, right? See, don't think like the rest of the 70% will be direct, like an image of seizure will be given, what is this seizure? No, they will not ask like that. I am saying like rest of the 70% will be clinical, but it can be okay, like you can just guess it. But this is 30% is integrated with medicine plus radiology. This time this will be 100% gunshot. And one more thing I want to explain. This time medicine will be a 15 times more tough than the previous paper. Just remember my word. It will be 15 times. Generally INICET medicine will be a tough level, but this time it will be 15 times tougher, right? And one more thing is the pathology. 50% of the pathology, 50%, trust me, it will be integrated, and 18% will be clinical, and rest of the pathology will be direct questions, right? So this is all some things. Actually these 3 days I am analyzing each and every AIMS question paper. See, don't think like sir what this analysis will do. They will randomly pick the questions. No. See, even the AIMS professors, they follow a pattern, they follow a format. See, they always depend on the recent trending topics, something like YouTube only. Yes, recent trending topics. For example, there is a viral infection that is being a heavy spread in Delhi or something like in metropolitan cities. Obviously they will drop these type of questions. Why? Because if you want to join a PG, obviously you will be dealing with the patients directly. For example, if you are doing in AIMS, INICET is all about AIMS. So if you are doing in AIMS Delhi, then obviously you will be getting those patients only. So what is the trending infection or trending disease right now, obviously they will be dropping that one in the examination. So don't think like some hush and bush type of questions will be coming. No, it's all about analysis. It's all about analysis. For example, there is a extreme spread of viral infections. We'll be getting a number of questions on the viral immunological detections, immunological tests, serology tests, treatments and updates, all sort of these things, right? So just remember, so from tomorrow onwards you will be having surgery, and the surgery will be taking place for nearly 3 days. Yes, yes, yes. Some people may give an exclamatory mark on their face. So for physiology only you took something like 6 days, but surgery you are just taking 3 days. That means you are skipping some topics. No, no, I will go into in-depth analysis. Don't just be fearful, right? I will go into in-depth analysis, and after my 3 days of class there will be no need for going to revision once again. My class will be the final revision, right? Then after surgery, I'm sorry, just because I have postponed SPM, but after surgery surely I will make SPM. Okay, so that's all for the update. So sorry that I did not upload for the past 2 days, but from tomorrow onwards it will be a daily schedule, because I just kept something like a mid holiday for my hospital. So from tomorrow onwards we'll be getting all sessions day to day, and just follow the schedule. For example, if you want me to drop this schedule, see I'm writing here. So tomorrow it will be surgery, and the next subject it will be followed by SPM, followed by pathology, right? Guys, I'm saying once again, this time pathology will be a scoring subject. Don't think like, sir, just because it's an integration maybe we might lose pathology. No, I'm saying once again, just do 2 revisions for sure, and in-depth revisions of pathology. And SPM always and always and always a scoring subject. Always I'm saying revise SPM, and trust me, this time 5 questions from the programs, 5 questions from the programs: anemia program, infections program, central programs, central government programs, schemes, all these things. At least 3 questions are direct questions from all these things. So 5 questions from the program. Brothers and sisters, please revise the SPM. And my suggestion is, always I tell my students, revise SPM just before the exam, something like 2 days before the exam. SPM, FMT, they should be revised 2 days. FMT you should revise on the exam day itself, at least the day before the exam. On the exam day you should go on with the sections of laws, criminal laws, sections of laws, section 89, section 320, section 498, section 81, section 76, all these 376, A, B, C clauses, all these clauses. What deals with 376B? What is the section for witness tampering? You'll be getting a case like a murder has happened, and one of the accused B has just tried to tamper the witness. Under which section it will be coming on? That's sort of a clinical question. You just mug up with the sessions on the day before the exam or on the day of exam itself, right? So I have given you all sort of the information. So from tomorrow onwards it will be surgery, followed by SPM, followed by pathology, and the next subject is something very special, that is gynecology. And some of the doctors has asking me, sir, what about neuro? So please explain the neuro anatomy. Yeah, I will explain neuro, and after gynecology we will be finishing anatomy. And don't worry, there is a special schedule that I have designed for anatomy. For each and every day you will be having a special 15-minute session of anatomy every day. 15 minutes. Nearly we will be discussing 8 to 12 core high yield images. For example, you will be given an image and you will be given a clinical scenario and you will be given some sort of symptoms and you will be given what sort of structure passing through this foramen that leads to this problem or through this for this condition. So all this sort of things that will be explained here. No problem, no, don't get fear. This time we will try hard to pass through the INICET for with a good rank. And one more thing is, one of the doctors has asked me, just I want to take some of your time. One of the doctors has asked me, sir, please can you just don't take it a brief thing, but I just have a doubt regarding the vectors of the ECG. So I think the doctor's name is Dr. Siraj. Dr. Siraj, I want to tell you one thing. He just made me a comment like, sir, actually I know how the ECG looks in a tachycardia, I know how ECG looks in a hyperkalemia, I know how a ECG looks in arrhythmias and all sort of these conditions I know, but the only thing that makes me confused is vectors. Can you please explain in a shortcut way what these vectors are in a minute, just basic, sir? I was like surprised. See, if you don't know the vectors, I'll tell you only one statement. You marry a woman but you don't know, I mean, how to produce the kids. That is insanely something very sad, right? You got a woman, she's beautiful, she's cool, she's very good, she has a good character, but you don't know how to produce kids with her. And you may think like the woman will, yeah, I think the woman may take a step, but obviously the woman will expect you to take the step. But if you don't know the real deal, that's even you admire her beauty, but there is no point of benefit after all marrying a woman if you don't know how to make the kids. The situation is like that. If you don't know the vectors, even though you know the ECG patterns in different conditions, obviously you will fail in INICET. Trust me, because the INICET professors are not a simple fools to give you a direct pattern like an inverse T wave so that you can easily know. Not like that. They will just confuse you. They will give you a triple wave, they will give you a double wave with a sawtooth appearance, all sort of these things. So they will just twist you, make you confused, make the student a confusion. So the only thing that I will give you is, I will just give you a just small 0.5 inch of basic. So just listen to me, listen, right? Just a minute.